Welcome to our comprehensive guide on Fycompa side effects, exploring the common manifestations associated with this medication and their potential impact on seizure control. If you or a loved one are considering or currently taking Fycompa, it's essential to be informed about the potential risks and benefits. Fycompa is a prescription medication often prescribed to manage seizures, particularly in people with epilepsy. Like any medication, Fycompa may cause side effects. By understanding these side effects and their relationship to seizure control, you can make more informed decisions and better manage your treatment. In this video, we'll dive into the common manifestations of Fycompa side effects and discuss their potential connection to seizure control. We'll cover both the typical side effects that may occur, as well as more severe or less common ones that require immediate medical attention. Remember, always consult with your healthcare provider before starting or adjusting any medication. Let's explore the world of Fycompa side effects and gain a deeper understanding of this important aspect of seizure management. Common side effects of Fycompa. When taking any medication, it's important to be aware of the potential side effects that may occur. Fycompa is no exception. While not everyone experiences side effects, it's essential to understand the common manifestations associated with this medication. One of the most frequently reported side effects of Fycompa is dizziness. Many individuals who take Fycompa may experience mild to moderate dizziness, which can impact their daily activities. This side effect is often temporary and tends to improve over time as the body adjusts to the medication. Another common side effect of Fycompa is drowsiness. Some people may feel excessively tired or experience difficulty staying awake during the day. It's important to exercise caution when engaging in activities that require alertness, such as driving or operating machinery, if you're experiencing drowsiness as a side effect of Fycompa. In addition to dizziness and drowsiness, Fycompa may also cause changes in appetite and weight. Some individuals may experience an increase or decrease in appetite, leading to weight gain or weight loss. These changes can be managed by maintaining a healthy diet and discussing any concerns with your healthcare provider. Understanding the connection between side effects and seizure control. While experiencing side effects can be challenging, it's important to remember that seizure control should be the primary focus when managing epilepsy. The connection between Fycompa side effects and seizure control is complex, and it's crucial to work closely with your healthcare provider to find the right balance. Certain side effects of Fycompa, such as dizziness and drowsiness, can potentially impact seizure control. If these side effects are severe or persistent, they may interfere with your ability to carry out daily activities, which can increase the risk of accidents or injuries. In such cases, it's important to consult your healthcare provider for alternative treatment options or adjustments to your current dosage. On the other hand, it's worth noting that some individuals may experience improved seizure control with Fycompa, even if they encounter mild side effects. Each person's response to medication is unique, and finding the right balance between managing side effects and achieving optimal seizure control requires careful monitoring and collaboration with your healthcare provider. Physical side effects of Fycompa. In addition to dizziness, drowsiness, and changes in appetite, Fycompa may cause other physical side effects. These can include headaches, nausea, and fatigue. While these side effects are generally mild and temporary, it's important to communicate any concerns to your healthcare provider. Headaches are a common side effect of Fycompa, especially during the initial stages of treatment. These headaches are usually temporary and tend to subside as the body adjusts to the medication. However, if you experience severe or persistent headaches, it's crucial to seek medical attention to rule out any underlying causes. Nausea is another physical side effect that some individuals may experience while taking Fycompa. This can range from mild queasiness to more pronounced feelings of nausea. If you find that your nausea is severe or interferes with your ability to eat or drink, it's important to discuss this with your healthcare provider to ensure proper management. Fatigue or excessive tiredness is another physical side effect that some people may encounter when taking Fycompa. It's important to listen to your body and prioritize rest when needed. If your fatigue becomes overwhelming or affects your ability to carry out daily activities, it's important to consult your healthcare provider for further guidance. Cognitive and psychological side effects of Fycompa. In addition to physical side effects, Fycompa may also cause cognitive and psychological manifestations. These side effects can vary from person to person and may include difficulties with concentration, memory, mood changes, and irritability. Difficulties with concentration and memory are among the cognitive side effects that some individuals may experience when taking Fycompa. These can manifest as forgetfulness, trouble focusing, or difficulty retaining new information. If you find that your cognitive function is significantly affected, it's important to discuss this with your healthcare provider to determine the best course of action. Mood changes and irritability are psychological side effects that have been reported with Fycompa use. Some individuals may experience increased irritability or changes in mood, such as feeling more anxious or depressed. It's important to communicate any concerns about mood changes to your healthcare provider, as they can provide guidance and support. Managing and mitigating Fycompa side effects. While it's impossible to completely eliminate all potential side effects of Fycompa, there are steps you can take to manage and mitigate their impact on your daily life. Here are some strategies that may help. Follow your healthcare provider's instructions. Always take Fycompa as prescribed and follow your healthcare provider's instructions regarding dosage and timing. This can help minimize the risk of side effects. Stay hydrated. Drinking enough water throughout the day can help alleviate some side effects, such as dizziness and headaches. Stay hydrated to support overall well-being. Maintain a healthy lifestyle. Engaging in regular exercise, eating a balanced diet, and getting sufficient sleep can contribute to overall well-being and potentially reduce the severity of side effects. Avoid alcohol and recreational drugs. Alcohol and recreational drugs can interact with Fycompa and potentially worsen side effects. It's important to avoid these substances while taking this medication. Communicate with your healthcare provider. If you experience any side effects that concern you or interfere with your daily life, it's crucial to communicate with your healthcare provider. They can provide guidance and support to help manage and mitigate these side effects. Communicating with your healthcare provider about Fycompa side effects. Open and honest communication with your healthcare provider is crucial when it comes to managing Fycompa side effects. Here are some tips for effective communication. Keep a symptom journal. Track any side effects you experience, their severity, duration, and impact on your daily life. This can provide valuable information to share with your healthcare provider during your appointments. Prepare a list of questions. Before your appointment, write down any questions or concerns you have about Fycompa side effects. This will ensure that you address all your concerns during your discussion. Be proactive. If you notice any changes or new symptoms, don't hesitate to reach out to your healthcare provider between appointments. They are there to support you and can provide guidance based on your individual situation. Long-term effects of Fycompa use. While Fycompa is generally well tolerated, it's important to consider the potential long-term effects of its use. Long-term use of Fycompa may have different implications, including the possibility of developing tolerance or experiencing changes in seizure frequency. Tolerance refers to the body's reduced response to a medication over time. In some cases, individuals may require higher doses of Fycompa to achieve the same level of seizure control. It's important to monitor changes in seizure frequency and discuss them with your healthcare provider to ensure that your treatment plan remains effective. It's also worth noting that long-term use of Fycompa may have other considerations, such as potential interactions with other medications or the need for periodic monitoring of liver function. Regular checkups with your healthcare provider are essential to assess the ongoing effectiveness and safety of your treatment. Alternative treatments for seizure control. While Fycompa is a widely used medication for managing seizures, it's not the only option available. If you experience intolerable side effects or if Fycompa does not provide adequate seizure control, there are alternative treatments that you can explore in consultation with your healthcare provider. Other anti-epileptic medications may be considered, either as monotherapy or in combination with Fycompa. Your healthcare provider will consider various factors, such as your specific type of epilepsy, medical history, and individual response to different medications, when determining the best course of action. In some cases, non-pharmacological approaches, such as ketogenic diet, vagus nerve stimulation, or epilepsy surgery, may be considered as alternative treatment options. These approaches can be effective for certain individuals who have not achieved adequate seizure control with medication alone. Conclusion and final thoughts on Fycompa side effects and seizure control. When it comes to managing seizures, finding the right balance between effective seizure control and managing side effects is crucial. Fycompa is a commonly prescribed medication for seizure management, but it may cause side effects that can impact daily life. By being aware of the potential side effects, understanding their connection to seizure control, and maintaining open communication with your healthcare provider, you can make informed decisions and optimize your treatment plan. Remember, everyone's experience with Fycompa is unique, and finding the right balance may require some trial and error. If you have any concerns or questions about Fycompa side effects, always consult with your healthcare provider. They are your best resource for personalized guidance and support on your journey towards optimal seizure control.